A very good afternoon to all of you. I am Dr. Ruchi Shirudkar, director of an organization called as Periodical. First of all, I would like to really apologize with you all for not coming live for almost more than a month. It's been a little hectic because of the increasing COVID cases, and our webinar was going on for 10 weeks. So it was a little hectic with all that, and I was not able to go live and take a remedy or something. But I really apologize for it. And I want to thank you all for being such nice, always being so nice and always motivating me and giving me that support that I feel is great. And we had a very great response to our 10 weeks webinar. Almost 230 students and doctors attended, and it was really great. I got to learn so many new things while teaching you all. So it was wonderful. Today, the remedy that we are going to discuss today and we're going to learn and throw light upon is arsenic album. Arsenic album is so oftenly used. It's a big polychrist. I am sure you know a lot about arsenic, and let's see what we all can learn more about arsenic. So the biggest problem that people say is how to pick up remedies in pediatric practice. On the contrary, I feel that in pediatric or in kids, to understand kids, it's much easier, because they are their natural self. अगर उनको जिद करनी है तो वो क्लिनिक पे ही लेट जाएंगे. They will not think, oh, this is clinic. So it's very easy to pick up in clinic. I'll give you a recent example of arsenic where I have used in 2 COVID cases. First, I will tell you about a child who was just 2.5 years old, and he was COVID positive. And I asked mother that what is the problem. He said he has fever and he has running nose. And so I said, what he's doing? So the moment a little bit of nosy comes out of his nose and he wants me to wipe it. So he's always like, Mama, wipe it. Mama, wipe it. So a little bit of, that dripping of nose also is there. Then he wants to wipe it and clean it, right? And from that symptom, I had given him arsenic 30 single dose, and that was it. Next day, there was no fever, no running nose, nothing. So what it is that fastidiousness, cleanliness and carried desire to be fast. कि यार जल्दी इसको वाइप करो. तो जो बच्चे थोड़ी सी भी नाक बहने पे, थोड़ा सा भी कुछ खाना अगर टी शर्ट पे गिर जाए, they always wants to change their clothes. That is the biggest tip to pick up arsenic in your clinic. I have given to so many kids where mother is sitting and the child is sitting next to her, and they keep on telling mother, nosy is coming, you wipe it. So mama is saying, oh my God, she's harassed me, I'm always wiping her nose. Thoda bhi isko nosy aata hua chalta nahi. So you can think it is arsenic. Carried desire to be fast and very fastidious. In sulfur, we have studied ki they eat their discharges, or they, if they have done potty, they'll keep playing on it and they'll not be bothered. But if arsenic child has wet his pants, or even a small infant or a newborn, they would cry and they would want you to change as quickly as you can. So they are very fastidious, very clean. अब obviously एक 6 महीने का बच्चा या 2 साल का बच्चा fastidious नहीं बोलेगा ना, या बोलेगा नहीं कि मुझे सफाई चाहिए. आपको वो चीज पिक करनी आनी चाहिए. Are you understanding? You should know how to pick that in clinic. And one more thing that I really want to tell you all is stop being a converter. Don't be a converting machine to the rubrics. People say the patient is saying, I am tired of the treatment. What rubric would be? Patient is saying one line and you want to convert it into the rubric. That really doesn't help. And in children too, it doesn't help at all, because you have to understand the feeling behind that line, the intention behind that, what their person is saying. When the child wants to be cleaned his t-shirt or wants to wipe his mouth, खाना खिलाते हैं ना parents, और थोड़ा बहुत बच्चों को यहाँ वहाँ गिरने लगता है, so mother is sitting with a spoon in one hand and a handkerchief or a towel in another hand. She said, thoda bhi lag gaya na, he doesn't like. So in the middle of feeding, and I have to get up and change his, t-shirt or something. So that you should know how to, and they are very, very irritable during pain. So pain intolerant or very irritable during pain, they will be crying, they want to be carried, they want to be carried fast. अब carried fast को आप दो तरीके से ले सकते हैं कि आप उनको घर में लेके घूम रहे हैं, या फिर वो चाहते हैं कि ये पेन आप जल्दी ठीक कर दीजिए, डॉक्टर साहब जल्दी ठीक कर दीजिए बस, but so there are two things. One thing which is very, very common, I am sure you all must be knowing about it. And one thing that we have to break the image of arsenic that we all have in our mind and think or see arsenic beyond our imagination. The first case of COVID, I told you about that child. And second case of COVID, I had discussed in the last seminar also, was of a doctor. He was a homeopathic doctor working in a COVID hospital. And he ended up with COVID. So there were a lot of symptoms, like anxiety, fever during and all that. But was the main thing in that case was the patient felt that, I am just 30, 32. My children are very small, 2 years, 4 years. And I have planned my life in some other way. And I feel that I have not, there's so much to do more. And I have still not, the house is still not made and there's a lot to do more. So subconsciously, here the patient is thinking about death, there is no death presentiment of. What usually happens is when you listen to these version, you tend to form rubrics that death thoughts of, death presentiment of, fear death of. But the patient is not talking of fear. Patient is saying that I have planned my life in a different way and I feel there is a lot more to do and feel that his duty is yet not done. The children are small. So the rubric taken was anxiety, duty as if he has not done. Right? Anxiety. घबराहट हो रही है उसको क्या सोच के कि यार जो मेरी ड्यूटी है आई हैव नॉट डन. इट्स नॉट निग्लेक्टेड ड्यूटी. निग्लेक्टेड ड्यूटी कब आता है? जब आपको पता है कि this is my duty, I know that I have to cook for my child and I'm like, okay, कर दूंगी यार, let me see the mobile now. So I am neglecting my duty, something that I'm supposed to do. But what the patient was saying here is that I have not done my duty, I have not neglected, I have planned something else. Arsenic isn't planning and programming. They program everything, they plan everything. So if the patient comes to you and say, डॉक्टर आप पहले मेरा ना ये एक्ने ठीक कर दीजिए एंड देन वी विल सी दिस एसिडिटी एंड देन वी विल गो टू द लेग पेन. सो व्हाट ही while narrating is this, what the patient is doing, patient is planning and programming ki first this, second this and third this. This is planning and programming of arsenic you will see in lots of COVID cases because there are so many rubrics that you get in present COVID situation, but arsenic you should not give to every patient. Why my experience with COVID is that you understand the patient, physicals as well as mentals. You understand what is bothering the patient most. Fear है, anxiety है, बच्चों की चिंता है, family की चिंता है, death है. कुछ patient बोलते हैं कि अरे मुझे कुछ नहीं लग रहा. So it is fearlessness. अरे मुझे पक्का पता है मैं ठीक हो जाऊंगा. Is it positiveness? मुझे लगता है मैं ठीक हो जाऊंगा. Is it hopeful? मुझे बहुत डर लग रहा है, बहुत एंजाइटी हो रही है, एंजाइटी fear with. So take the complete physical and mental picture and then come to a specific remedy. And if you come to the exact remedy, the results are amazing. And always remember the patient comes first. The patient is of utmost importance. I'll tell you some rubrics of arsenic that we see nowadays in COVID patient. Well says well, sick when very. Patient को 104 बुखार होगा और आपसे उससे पूछो कैसा लग रहा है, मैं ठीक हूँ. Delirium well declares he is. घर वालों को डिक्लेयर कर देता है कि यार मैं ठीक हूँ, मुझे कोई प्रॉब्लम नहीं हुई है. Okay? Delusion, everything one is touching is contaminated. जो आजकल लोगों को हो गया ना कि यार मैंने अमेज़न का पार्सल आया, मैंने उसको हाथ लगा लिया. I have touched. Oh my God, it must be contaminated. They are washing their hands again and again. There's a lot of anxiety. There's fear of disease, contagious epidemic disease of washing, desire to wash hands. So delusion, everything one is touching is contaminated. मतलब मैंने इस ग्लास को हाथ लगाया, ओ माय गॉड ये कहीं कंटामिनेटेड तो नहीं था, इस पे वायरस तो नहीं था. आर यू अंडरस्टैंडिंग? डिल्यूजन, डाई, अबाउट टू डाई, अबाउट टू डाई, अबाउट टू मतलब अब मैं मरने वाला हूँ. आपने अभी रिसेंटली परसों के पेपर में एक मिस्टर राहुल करके यूट्यूबर हैं, उनका वीडियो आया था और एक पोस्ट आया था. तो व्हाट ही वाज सेइंग, मैं अब हिम्मत हार गया हूँ, मैं मरने वाला हूँ. तो व्हाट इट इज, डाई, अबाउट टू डाई, अब मैं मरने वाला हूँ. आर यू अंडरस्टैंडिंग? टाइम हैज कम, डाई, टाइम हैज कम, मेरा समय आ गया है अब मरने का. एक पेशेंट ने मुझे बोला, मुझे ऐसा लग रहा है कि मेरी जीभ लकड़े की बन गई है, यू नो. तो डिल्यूजन, टंग, वुड, टंग इज मेड ऑफ. यार मुझे लगता नहीं है कि मैं ठीक हूँगा, मेरे को लग रहा है मैं ठीक हूँगा कि नहीं हूँगा. सो डाउटफुल रिकवरी ऑफ, यार ये मेडिसिन किसी काम की नहीं है, देयर इज नो यूज ऑफ टेकिंग दिस मेडिसिन. डाउटफुल रिकवरी ऑफ मेडिसिन इज यूजलेस. ये सब मैं आपको I'm telling you in relation to COVID, right? Then we'll go back to arsenic and its drug picture and how you can pick up in clinics. Despair, recovery of, यार मेरे को लगता नहीं है मैं ठीक हूँगा, मुझे बहुत डाउट है कि मैं ठीक हूँगा कि नहीं हूँगा, ये मेडिसिन किसी काम की नहीं है, कोई पॉइंट ही नहीं है दवाई लेने का, मेरा टाइम आ गया है, अब मैं मरने वाला हूँ. जब पेशेंट ऐसे वर्जन बोले, convert it into rubrics and arsenic comes very very close. Mind you, arsenic is not the only remedy. There are many other remedies. Fear contagion of, fear death of, medicine is useless. Fear death of respiratory complaints in. And there is a lot of anxiety about children, anxiety about family, love children for, refusing treatment, sick in spite of very. मतलब उसको लगता है मैं ठीक हूँ, डिक्लेयर कर देता है. डिक्लेरेशन क्या होता है? जब हम सबको बता देते हैं, यार मैं ठीक हूँ, मुझे कोई बॉदर मत करो, एंड आई डोंट वांट एनी ट्रीटमेंट, आई फील इट इज यूजलेस टू टेक दीज मेडिसिन्स, आई एम गोइंग टू डाई, एंड या दिस काइंड ऑफ वर्जन. एंड वन मोर थिंग दैट आई हैव सीन इन आर्सेनिक फीमेल्स इज दैट काम पड़ा है, दे कैन नॉट यू नो sleep or rest. They want to do finish of the work. 103 बुखार होगा फिर भी वो बर्तन रखेंगी because maids are not coming. They will put the utensils in place, put the clothes in the washing machine, cook the food and then rest. So what's the rubric is? Rest cannot rest until things are in proper place. Are you understanding? Now I want you all to be active. Put your questions, put your experiences so that I can answer your queries also. What kind of versions you are seeing in COVID patients? I will give you a homework this time, and who all are there in this group, you have to write down rubrics and tell me what is the experience. And there is a key called as FN F4, which is function and F4, right? So you press FN and you press F4 of your computer keyboard together, and there is a tab which comes. In that tab, you can write down words and search all the rubrics related to that word. So when I was treating patients in COVID, what I really did was I studied all the rubrics considered related to respiration. Write down these words: respiration, anxiety, respiration with impeded. चेस्ट, एंजाइटी, कॉन्स्ट्रिक्शन, चेस्ट दबी दबी लग रही है, बहुत घबराहट हो रही है, चेस्ट पे प्रेशर लग रहा है. आर यू अंडरस्टैंडिंग? सो चेस्ट, रेस्पिरेशन, ब्रेथ, यू नो, फीवर, हीट, पेन, and study all the rubrics concerned with these words. Search pneumonia, anxiety, pneumonia in, you know, hopeful in a lung disease, prolonged aurum. I have given to a patient where he was already suffering from a chronic interstitial lung disease, but he was still very hopeful. So sometimes you get a medicine through a drug picture, and sometimes you're able to solve these cases by these single rubrics. So study. This is a homework that I'm giving you. Study all the rubrics related to respiration, breath, heat, pain, fever, understand what that fever is doing to that patient, what kind of insecurity the patient is going through. कुछ लोग बोलते हैं, अभी एक बूढ़े अंकल थे दिल्ली के, एंड व्हाट ही वाज टेलिंग दैट लॉकर की चाबी यहाँ रखी है, टर्म प्लान के पेपर्स यहाँ हैं, he was telling his wife all this. So there is a rubric that he must settle his affair, the death is near, that he must settle his affair, so which has petroleum, arsenic, and I think one more remedy. So death है ना, हॉरिबल थिंग्स, सैड स्टोरीज अफेक्ट हिम प्रोफाउंडली. रोज हम सुन रहे हैं किसी की डेथ हो रही है, बैड न्यूज. मेरे को खबर आई कि मेरी मौसी की डेथ हो गई है, उसके बाद मुझे बहुत घबराहट होने लगी. सो एलमेंट्स फ्रॉम बैड न्यूज देख के घबराहट होना. I had a patient recently of COVID where that lady called me up. I'll not tell the remedy now because I'm going to take a seminar on COVID and where we'll discuss all these cases. She called me up and she started crying, and what she was saying was, we have failed as a system. India has failed. People are, hospitals are full and people are lying, in bed. Yeah, so we have failed as a system and I feel so bad. And she was crying and crying about it. So we have to understand what is bothering the patient, what is affecting the patient. Here the patient was talking about society in general, whereas some people you will understand they're talking about their children. Some you will understand are very fearful for them, So understand the state of the patient. Okay, there are 115 people, but I don't see a lot of you active. Facebook has started one more thing, I think a star thing. So it would be nice if you can send stars while this Facebook live is going on. And ask questions. What is the point of live? I could have recorded a video and put it on Facebook. I'm going live because I want you all to come up with questions, your queries, your experiences with COVID and all that. So coming back to arsenic. Arsenic is full of fear and anxiety about health, own health, about family health, about children. There are lots and lots of fears in arsenic, and the arsenic wants to be carried fast. जल्दी ठीक होना चाहता है. Arsenic में दोनों चीजें हैं. Though lot of people only know arsenic as biting tumbler. What is biting tumbler is? Tumbler is one thing which feeds you, you drink from that and you bite that only. So the person who's taking care of you, you are getting irritated on that person. For example, आपका हस्बैंड है या बच्चे हैं जो आपका ध्यान रख रहा है और आप चिढ़ रहे हो, आप बोल रहे यार पानी लेकर आ, अरे यार कितना गर्म ले आया, थोड़ा ठंडा लेकर आ यार, इतना गर्म, अरे यार ये तो बिल्कुल ही गर्म नहीं है, इसको ल्यूकवार्म तो लाओ. सो दिस काइंड ऑफ इरिटेबिलिटी, biting tumbler, we take it. You are getting irritated on the people who are serving you, who are taking care of you, who are nurturing you. Are you understanding? So they are very, very irritable during pain, but I have given arsenic to people who are not complaining. There is a rubric, self-control increased. They are keeping themselves in control because they have anxiety about children, anxiety about family, like this. So in those cases also I have given arsenic. Okay, so it can be used both ways. It can be used in irritability or self-control increased. So try to understand the state of the patient during that disease. Okay. One more thing about arsenic, that during sickness they can say that they are well, as I have said. But one more thing, if you ask them about their recovery, कि यार कैसा लग रहा है, कल से अच्छा लग रहा है, they get very irritated. And the recovery if asked about. Okay. Write down these rubrics. Am I not able to see the comments, or you all are not writing? Okay, I don't know. Okay, so I have written some things about anger recovery if one spoke of her. If you ask him about his recovery, he gets very, very irritated. Right? In children, it is written, quieted cannot be carried only by being. मतलब बच्चे को जब दर्द है या फीवर है तो वो चुप नहीं होता है, रोता रहता है. only if you carry him. So the parents are exhausted. Parents are, मैं रात भर इसको गोदी में लेके घूम रही हूँ. You know, doctor, I'm really tired. This child is just not stopping to cry, and I'm always carrying him since 4 hours. So the mother would come with like hair lost, you know, she'll be all tattered and she'll be like, I'm exhausted. बच्चे ने तो दम नाक में दम कर दिया है. So quieted cannot be carried only by being. Okay. Or the arsenic can come. So there are various states of arsenic that they can come in. They can come in delirium well, or they can come in a lot of anxiety, or they can come in self-control increased and a lot of care about children and family, or they can come in like in a state of biting tumbler where whoever the person is accompanying would tell ki, you know, she is creating a lot of havoc in the house and we are tired and she's demanding so many things and not satisfied with whatever we are doing. Okay. Or they can come to indifference recovery too. What is indifference recovery too? When a person has 2-3 complaints, or डॉक्टर साहब ये कोविड ठीक हो ना हो, आप मेरा बुखार उतार दो यार, ये दर्द कम करो, ये सर दर्द कम कर दो, मुझे मतलब नहीं कोविड हो ना हो. So what it is, you are not concerned about the disease, you are just concerned about the pain or the fever that is bothering you. You know, मेरे को नहीं फर्क पड़ता, मेरे को 50 दिन कोविड रहे, मेरे को कोई लेना देना नहीं है, पर ये हेडेक जाए अभी का. No, that is indifference recovery too. You're not concerned. What is recovery? Recovery is fully recovered from a state. You fully recover from a disease state. Whereas in arsenic, there are only 2 remedies, I think, arsenic and calcarea. So when patient says all this version, understand the patient, form a rubric and form a totality. ऐसा नहीं होना चाहिए कि बाकी सब कुछ भी arsenic का नहीं है, only with one sentence you are giving. So in that case, either that sentence should be very, very strong and characteristic and defining the case, or you should neglect that sentence and form a totality and then prescribe. क्या होता है, जब हम दवाई कोई भी पढ़ते हैं तो हम एक पिक्चर बनाते हैं दवाई की, पर जब वो पेशेंट आता है तो वो कोई एग्जैक्ट पिक्चर लेके नहीं आता. तो हम सब के साथ, इवन मी इंक्लूडिंग, when we are treating, we evaluate, you know, there are rubrics, suppose 10 rubrics I have formed of a case, then you will understand, okay, 7 is covered by arsenic, or, you know, sulfur is also coming close. And then you have to just, you know, just close your eyes and just think, what is bothering this patient most? What is the characteristic of the case? And put that rubric in higher your totality and then prescribe. Because ऐसा नहीं होता है कि सब कुछ आपको ड्रग पिक्चर की तरह मिले, कि आइडियल जैसा बुक में लिखा है वैसा ही पेशेंट आए और आपको, you know, you are very sure कि okay, this is arsenic. You always have that tussle in your mind, and you always have that, you know, thought in your mind कि what needs to be given. Is it arsenic? Is it sulfur? Is it a lot of fear in calcarea? So don't get stuck to these images. These images should only help us or guide us, but not make us prejudiced. Okay? Okay. I'll again say I am not able to see your questions. Okay. Okay, anyways, I'll carry on because I don't know why I'm not able to see the questions. Okay. So by nature, arsenic is very selfish, very greedy, very avarice, कंजूस. अभी avarice और greedy में क्या अंतर है? Avarice होता है कंजूस, you know, you don't want to spend, and greedy is when you want everything for yourself. So you will see kids कि they will not share their food, they will not share their toys, they want, mama would say कि when we go to the park, you know, इसको अपनी चीज तो चाहिए ही चाहिए, दूसरे की भी साइकिल इसको ही चाहिए, you know, things like that. So they are very greedy, कंजूस होते हैं, अपना खर्चा नहीं, पर कब खुद पे आता है, जब खुद की बीमारी होती है, they will spend. So they are selfish. We all know of fastidiousness and cleanliness mania for arsenic, and lot of our seniors have differentiated the cleanliness of arsenic with nux vomica. I will do it for you all once more. कि आर्सेनिक को प्रेजेंटेबल रहना, कि कपड़े अच्छे होने चाहिए, यू नो, द टाई शुड बी प्रॉपर, द क्लोथ शुड बी नीटली आयरन्ड, इफ सम गेस्ट कम इन द हाउस देन एवरीथिंग शुड बी नीट एंड प्रॉपर, एवरीथिंग शुड बी kept in proper place. Rest cannot when things are in proper place. So arsenic ऐसा रहता है, whereas nux vomica is fastidious about his work, you know. So nux vomica is very, उसकी टेबल और क्लिनिक और घर मेसअप हो सकता है, बट वट एवर द वर्क दे आर डूइंग, इफ दे आर प्रिपेयरिंग अ प्रोजेक्ट, दैट प्रोजेक्ट वुड बी प्रिम एंड प्रॉपर, यू कैन नॉट फाइंड अ मिस्टेक इन दैट. सो arsenic is more about presenting and nux vomica is more about what, यू नो. आर्सेनिक अगर घर में मेहमान हो रहे हैं तो सारा कचरा एक बार का अलमारी में डंप कर देगा, बट नक्स वोमिका को प्रेजेंटेशन का कोई चिंता नहीं है. सो देयर यू कैन डिफरेंशिएट द फस्टिडियसनेस ऑफ आर्सेनिक एंड नक्स. बट अगेन आई वुड से देयर आर लॉट मोर रेमेडीज विच आर फस्टिडियस in our new repertories. So understand the fastidiousness of those remedies also. Okay. Recently I have prescribed arsenic to a lady. She was saying she had a lot of, I think, vaginal itching. So she was like, बहुत itching हो रही है डॉक्टर साहब, मैं बहुत परेशान हो गई हूँ. So she was complaining pitiful. That is the first rubric I took, and it has two remedies only, which is arsenic and pulsatilla. But pulsatilla का pitiful में आपको तरस आता है, and arsenic उस complaining pitiful के साथ बहुत irritated रहता है. They are very very irritable during that pitiful. तो घर वाले ना परेशान हो जाते हैं उनसे. So that is the difference that you can make. And I had given her arsenic. She was having vulval itching since almost a year, which responded beautifully after arsenic. Arsenic हर चीज ज्यादा करता है. Drinking more than she needs, walking more than he needs. So how will you take that? डॉक्टर मैं तो ना रोज हर संडे 20 किलोमीटर चलता हूँ. अरे 20 किलोमीटर चलने की जरूरत क्या है? मैं ना 20 ग्लास पानी पीता हूँ. इट इज नॉट रिक्वायर्ड. सो ड्रिंकिंग मोर देन शी नीड्स, वॉकिंग मोर देन ही नीड्स, मतलब जितनी रिक्वायरमेंट है उससे बहुत ज्यादा आप कर रहे हो. ओके तो ड्रिंकिंग मोर देन ही नीड्स, वॉकिंग मोर देन ही नीड्स, यू शुड थिंक ऑफ, आई थिंक इट्स सिंगुलर आर्सेनिक. And arsenic कितना भी irritable हो, but when he comes to the clinic, they are presentable, they are smiling. आपको लगेगा कि irritated हैं, घर वाले बोलेंगे, but आपके सामने मुस्कुरा के बोलेंगे. Okay, so this is a small thing about arsenic. There is a lot more about arsenic. We can probably do in one more video. Arsenic is very obsessed about diseases and, you know, washing hands, and so it is very very common these days. I'm very disappointed that I'm not able to see your comments today and I'm not able to answer your queries today. But by the end of May, we'll be doing a 2-day COVID seminar where we'll be discussing the COVID cases. You can register for the webinar beforehand. I really wanted to do before because but we were busy with this 10 weeks webinar for 2 months and I was not able to do. So we'll be doing it now. I think last Friday, Saturday of this month, we'll be doing a 2-hour webinar. I'll not be taking the pathology. I expect you all to learn and understand and read about the pathology, about COVID, and what is the role of D-dimer and interleukin-6, because diagnosis is very, very important. You should know where to stop. You should know what remedy is next to be given. Always remember the patient comes first. This is not the battle of homeopathy and allopathy. This is about the patient. This is about you being able to cure a patient, right? So आप इसमें बिल्कुल मत जाइए कि एलोपैथी बकवास है या होम्योपैथी ही ट्रीट कर रही है. आपका मेन फोकस सिर्फ पेशेंट को मिनिमम डोज में ठीक करना होना चाहिए. So that should be the main concern that you should all have. I will share what I do is, if a patient comes to me before taking, there are various stages in which patient comes. So if a patient comes to me on the day 1 or day 2 or day 3 where she has not started with allopathic medicines, I usually avoid giving a lot of allopathic, and I will specifically say don't give Fabiflu or Remdesivir and all that. If the patient is very anxious and wants to start with some ivermectin and all that, that's fine, because unnecessarily the patient should not get into anxiety. I said, okay, if that suits you, but I make it a point that not start with a lot of antibiotics and antiviral drugs. I take a proper case. Sometimes the state changes from day 2 to day 6, and you may require to give a different remedy on day 6 or a specific remedy also. Don't be rigid, I will do this only. What is best for the patient, do that. Prescribe single medicine, because that have better results rather than using combinations. Understand what is bothering patient the most and then prescribe, rather than going on one symptom. I will give you one more example of a learner also who had COVID, and she was saying a typical modality that I had a pain in coccyx while I have fever, but rest all was covered by pulsatilla, and that pain in coccyx while fever was not covered. And then I took a moment and I said that this is a particular and this is not very, very important. So I left that modality and prescribed on the basic concern that the patient had, right? So always evaluate when you are forming a totality. And if a person a CT score is very, very high, though I am treating patients with 20 or 15 or 17, and I'm sure you all must be also, then always take an opinion of a chest physician or an MD physician, because we really don't want any negligence from our side. We really don't want that any life should be in danger or lost because of our negligence. So the diagnosis and the values and everything is utmost important now, and we should be sensitive. No matter how busy you are, make a point to just drop a message. What I have done is make a list of COVID patients, and I just drop a message to someone that how are you doing, so that we know whether the patient is better or not. So study a lot, whatever rubrics I have told you and whatever keywords I have told you. Study all rubrics related to those keywords: fever, pneumonia, pain, epidemic disease, contagion, contagious. All these rubrics, all these chest heaviness, anxiety chest with load on, constriction of chest, respiration, breath. Study all the rubrics in the mind section and as well as particulars, so that you are more well versed about the rubrics. What happens most of the time, patient बोल रहा होता है but हमें exact rubric नहीं पता होता, and then we tend to take a closely coming rubric and we fail in our cases. So the more you study, the more you will get versed with these kinds of rubrics, and you will be able to apply all those rubrics in your practice, right? So I really want you all to cure maximum of your patients and do good, and be more knowledgeable and be more sensitive about what is happening in our society, and keep your mental strength high, because then you are able to help others. If you are sad and depressed, and then you tend to give the same kind of energy to your patients. So be positive and be sure, and not a false surety, but a very knowledgeable thing where you know what you're doing. It should not be like, okay, I'll cure this, but you don't know what is happening. So the pathology is very, very important. So thank you all. I'm very sorry that I'm not able to answer your queries, because I'm not able to see any of the queries today. And after finishing this, I'll go to the queries and I'll make sure that I answer all of them. And I'm pleased to see so many people, 130 people attending live, and who all wants to register for this COVID webinar of 2 days, which will happen in the end of May. You can contact me. I think you can get my number on Google, or I'll tell you my number in comment section, and you can contact me and register as soon as you can. Thank you.